the room, and I'm going to introduce myself and let my PEDS patient know and the mom know what I'm there for, what I'm going to be doing, explain it really thoroughly, ask if there's any questions. I'm going to perform hand hygiene, and I'm going to verify my patient. If they're old enough to tell me their name and birthday, I'll go ahead and have them read it back to me and I'll check their wristband, and then I'll just verify it with the parent or the supportive person that's in the room. Um, then I'll just go ahead and tell them I'm going to start my assessment. Some things that I need to know before the assessment is the level of consciousness of the child, and the activity tolerance, and whether it's like appropriate for the age group, if they're doing the things that they should be doing at that moment in their life. Then I'm going to start with the head, and some things I look for with the head is just symmetrical, make sure there's equal hair distribution, no lesions, scabs, or anything like that. Then I'm going to look at the face, note, there's no bruises or cuts or anything like that. Their eyes, make sure that their conjunctiva is pink and the sclera is white, that the mucous membranes in their eyes is moist and not dry. Their nose, you need to check and make sure they have a patent airway, not any signs of drainage or anything like that. Ears, make sure their ears are at the right level, whether they're like low or if they're equal to the top of the pinna. Let's see. Then you would have to look at their mouth. Make sure that the mucous membranes there are, moist. Make sure that their mouth is like the inside of their mouth is pink. You're gonna check their neck and check their lymph nodes and know if there's any like tenderness or knots or masses. Then you'll move to the chest, and that's where you'll do your cardiac. Listen to all the heart sounds. Listen to the apical pulse for a full minute. You'll need to know whether murmurs are present or not. While you're there, you can go ahead and do your respiratory assessment and listen to the five places on the chest and on the back. You want to look to make sure that there's no respiratory signs of respiratory distress, that their breathing is spontaneous and their chest is like moving equally and it's all unlabored. While you're there, you can also inspect the skin, make sure bruises, lesions, any type of thing like that, rashes. While you're there, you can also note there's no retractions. So then you will move to the abdomen, and in the abdomen, you always look, listen, and then feel. You never palpate or anything like that before you listen, because that can cause your bowel sounds to be hypoactive, and then that's not accurate bowel sounds. So you're gonna look, make sure there's no bruises, lesions, or type of knots or masses like sticking out. Then you'll listen in all four quadrants. If there is no bowel sounds, then you need to listen for a full 5 minutes. Then you can palpate. When you palpate, you just need to note like if there's any pain or tenderness, any masses or anything like that felt in the abdomen, and make sure those are all noted and reported to the physician. While you're there, you can go ahead and ask about urine, if they're having any pain or burning, frequent urination, are they having an adequate amount of urination out, when their last bowel movement was. It's important to know the color and the size and the consistency of that to make sure there's no issues there. Of course, you can verify it all with the parent if the child is too young or isn't really sure about those questions. You would check the lower extremities. Another thing to note is when you are doing your assessment, range of motion of the joints. Make sure that they have full function. Know if there's anything that would stand out, like their legs aren't the same length. They can't bend their joints the way that they should. Then you would check your pulses. It's important to do them all. Of course, you would start at the head and you do your carotid. Never do those together. Those are always done separately. Brachial, your brachial pulses. You can do your femoral pulses. You have your posterior tibialis pulses, your pedal pulses. Then you can check your capillary refills, which you can do it on your toes and hands, preferably both. Skin turgor, make sure it's less than 2 seconds. Anything longer than that is sign of dehydration. You would check the back, make sure there's no, bruises, lesions, any type of thing like that on the back. Make sure the spine is in alignment. There's no curvature to it. Um, then you can just make sure that if there's anything that you haven't done, you can also note that with the parent. It's a perfect time to do teaching with the parent and the child about the things that should be happening to their body. The last thing that you need to do is an assessment of the genitalia, which you just need to note if there's any drainage, any type of deformities like that. If it's a male, of course, you would need to know to make sure that the testes are in the correct location. If not, that needs to be provided to the provider. Of course, then you would just cover your patient back up and ask them if there's anything that they need. Bed rails need to be up ×2, lowest position locked with the call bell in reach.